Good afternoon. This afternoon we're going to be discussing the situation with non-communicable diseases in the Caribbean. You will recall in 2007, the heads of government signed the historic Port of Spain Declaration, which was 15 points, 27 commitments, including national multisectoral NCD commissions, risk factor reduction, healthcare quality and coverage, surveillance, and Caribbean Wellness Day. 7 years later, there was a formal evaluation of this declaration in order to learn lessons to further accelerate implementation and to inform the global monitoring framework on NCD's, the 25 by 25 commitment. The project finished its data collection in December 2015. We reviewed the results and validated them at a workshop in February 2016 in Port of Spain, and this meeting also made recommendations on accelerating action. Next year, 2017, is the 10th anniversary of the Port of Spain Declaration, and so the world will be looking back at us, and as the director, Dr. Etienne, said this morning, the Caribbean really needs to step back up its game. This was a meeting in February 2016 in Port of Spain. In terms of the research we have conducted, some of the highlights, as you know, NCD mortality in CARICOM is the highest in the Americas, that 40% of these deaths occur prematurely before the age of 70. This rate is double the rate in North America, and Trinidad and Tobago, Guyana, and the Bahamas have the highest premature cardiovascular mortality in the region of the Americas. Hypertension is our leading risk factor for death, and our diabetes prevalence is double the global rate. Only 8 of 10 countries are on course to meet WHO's 25 by 25 goal. In terms of gender, 60% of women among women, 60% are more likely to have diabetes. Women are twice as likely to be obese and have higher rates of physical inactivity. Among men, they are more than twice as likely to do binge drinking and to smoke, less likely to use health services, have worse control of chronic conditions, and higher mortality rates at every age. With regards to our children, childhood obesity, more than 10% in 7 countries, partly being driven by aggressive marketing of fast food companies. Less than a third of children get the recommended amount of physical activity. And all of this means that children are now having diseases, type 2 diabetes, hypertension, arthritis, among others. Marketing to children is relentless in some countries of the region, the result being that 30% of children's calories are now coming from sweets, drinks, salty snacks, and fast food, all of which could be designated as unhealthy food. This is an example of marketing to children directly in primary schools. These are book covers that are being handed out to children. It has the logo of the fast food company. It has fried chicken, and the children look at this all day. The same company also gives out calendars, pencils, pens, and so on. So children of this age really, under the rights of the child, have a right to an environment that's not obesogenic, and certainly this is an obesogenic environment that is being created in the primary schools, public and private. In terms of the Port of Spain Declaration implementation, a review of the country shows that the lowest levels of implementation are for those areas having to do with diet, schools, and communications. And the highest levels were for those areas where there were clear guidelines for action and support from regional or international organizations. For example, in surveillance, there's been support from CAREC, PAHO, and CARFA, and with Caribbean Wellness Day, support from PAHO and from CARICOM. The Port of Spain Declaration has been evaluated by countries each year between 2008 and 2015 using a one-page color-coded grid. This grid has now been revised and updated, and the 2016 version will be circulated shortly. Unfortunately, it's now 2 pages because in consultations with countries, they wanted some things added. So for example, the original Port of Spain declaration does not speak of alcohol harm. It only speaks of alcohol in terms of taxation for money for programs. The countries wanted alcohol harm indicators added to the grid, so we did. And we also added indicators around some of the commitments the heads made in July of this year. So it's now 2 pages. In the research, we looked at where is the money to come from to do all of these programs that we are proposing, and we looked at the role of tobacco and alcohol taxes. A study in 3 countries, Grenada, Jamaica, and Trinidad and Tobago, revealed that revenue from further increasing taxes could yield more than 37 million US dollars, which is 3 times as much as we would need to implement the WHO best buys, which were mentioned previously. In terms of taxation at present levels, WHO recommends that 75% of the sale price should be taxes. We have a wide range in the Caribbean. St. Lucia tops at 63%. These are 2014 figures. St. Vincent and the Grenadines is only 17%. So there are lots of countries with lots of room to increase taxes on tobacco, reduce consumption, generate money, and we are asking for some of this money to be earmarked for health sectors, as has been done in Jamaica. The declaration has had international impact. It helped shape the global governance of chronic diseases, paved the way for the 2011 UN high-level meeting. And at that meeting, over half of the 27 CARICOM summit commitments were reflected in the UN high-level NCD declaration. Caribbean Wellness Day, Wellness Week has been promoted by PAHO throughout the region of the Americas. In this final year of the project, we are focusing on dissemination. We have a robust website, onecaribbeanhealth.org, and we have had 27,000 page impressions between February and August of this year. This is our website. Please do visit. We also have been engaging with policymakers, heads of governments, health ministers, permanent secretaries and staff, CMOs and NCD focal points, and also with the general public through traditional and social media, and also meetings in countries. And we plan to do more of these meetings between now and March of next year when the project ends. In terms of new initiatives for preventing NCDs, one of the paradigm shifts that we need to pursue is that we need to recognize, as Dr. Chan says, that globalization of unhealthy lifestyles is a political issue. It is a trade issue, and it's an issue for foreign affairs. Few governments prioritize health over big business, she says. What we do in the physical and fiscal environment has more potential for impact than one-to-one counseling. This is not to say that we are moving away from the concept of personal responsibility. That concept is well ingrained in our societies. What we need to do now is to introduce the complementary concept of fiscal environment manipulation so as to make the healthy choice the easier choice by creating an environment where it's the cheaper choice. In terms of accelerating actions going forward, we recognize that NCDs have achieved a level of political priority. The challenge now is to translate this political will into policies and programs. We need an all-of-society approach. In many countries, we are doing this through, at the national level, NCD commissions. At the regional level, the Healthy Caribbean Coalition is acting as an important watchdog and trainer. In terms of the all-of-government response, at the national level, we are proposing interministerial task forces. Barbados has established one. And at the regional level, of course, COHSOD, COHSOD, and other CARICOM organs in order to bring the all of society, all of government, multi-sectoral actors to the table to respond to this NCD epidemic. Heads of government continue to play a very important role. And in the July of 2016 meeting, they issued a communique which stated that they recognized the 10th anniversary was coming up next year, that progress had been made, but it was variable, and they are proposing banning smoking, trade-related issues, banning advertising of potentially harmful foods to children, and elevating taxes on sugars, salts, and trans fats. So the COHSOD is being invited to note and accept the findings of the evaluation of the 2007 Heads of Government Declaration and to commit to implementing the decisions taken by the heads of government in July of this year. So specifically with regards to tobacco, the heads would wish to see CARICOM, all countries of CARICOM, 100% smoke-free by 2017 on the 10th anniversary. This would really make a statement to the world that the CARICOM is serious about the NCD epidemic and regaining its global prominence. We also need to look at implementing more widely the quoted regional standards for labeling of tobacco products. These are the labels that are being used now in Jamaica. They have a number of criteria that need to be implemented that you need for the box. Further, we need to look at the question of nutrition. Yesterday at the officials meeting, this slide got a lot of traction, and I know Minister Tufton from Jamaica also thinks that this is the way to go. These are color-coded nutrition labels. The labels we have now are too difficult. They are not user-friendly. These are the types of labels that are being used in the UK and elsewhere and have been proven to be much more effective than the writing in the fine print that you need a magnifying glass to figure out what it's saying on the thing. Here you can see right away this product is high in fat and reasonable in the other things, and you can decide if you want to purchase this thing. This thing changes behavior. I have a colleague whose husband went with her somewhere and they were using these labels, and he noticed on day one that all the foods he picked up were red across the bar. And by day 2, he started down to 3 reds. And by day 3, he was down to 1 red. And that was, an experience that she shared with me. So I think that this is something well worth considering. We also need to consider not only the inclusion of nutrition education in school curricula, but as Suriname mentioned yesterday, how do we get the results of these kinds of studies, for example, into the curricula for nurses, doctors, schools, and so on? Because she felt that, this level of reporting alone was not adequate. We needed to infuse it further into society. So the heads of government spoke, as I mentioned, about fiscal measures and taxation on these areas, with a proportion of these revenues earmarked to support health and other social sectors. And a CMO said to me yesterday, well, all of this is well and good, but how are we going to actually get it done? And one suggestion was that perhaps there could be some kind of regional product where the background information and the rationale for all of these products is put together as a draft, so it would be easier for countries to make the cabinet submission, and that instead of draft legislation, PSBVI, I'm looking at you now, instead of draft legislation, we should have the points that are needed to be in the draft, which would make it easier to get the legislation written. Right? Right, okay. Barbados has implemented one of these measures recommended, a tax on sugar-sweetened beverages, 10%. Unfortunately, the manufacturers have absorbed a lot of it. So we are hoping that in Barbados, we'll actually be increasing this tax to 20%, so that we can actually see a price differential on the shelf. There is an evaluation being done of this tax. The National Health Fund in Jamaica has earmarked funds for activities related to health and health promotion. The heads also want support, technical support for these implementation areas, and multi-sectoral task force in response. Further to what the heads said, we are also proposing that we consider enhancing the role of the lead head of government responsible for heads in the CARICOM quasi cabinet, PM Harris, whose photograph I have here. we need to find a way to engage. I know that CARICOM does engage, but I'm just wondering if there's another level of engagement where, you know, we could have a more substantive relationship with him. Very important, ministers, the Caribbean Development Bank does not have health as one of its portfolios. CDB cannot lend for health. When Trinidad wanted to borrow money for health, they went to the IDB because the IDB will lend for health, but the CDB won't. And this is because the ministers of finance of CARICOM, who are the board of CDB, could be encouraged by the ministers of health to change the method of operation of CDB so that, in fact, they have health among their portfolio, because we know that health is a substantive input for development, and they are a development bank. Also, we should ensure that health is in the budget negotiations and approaches to government development partners, because sometimes there's money left over and we try and access the money, but you see health is not among what was asked for, so the money cannot be used for health. And finally, to coming from a research institute, I'm asking, please, if we can get some money for research to guide interventions and evaluate their impact. The region needs to invest in research, because it is through research that we can find the best way to go forward. So love that body, and thank you very much.